Imagine waking up to find your government shut down, your healthcare in jeopardy, and your paycheck uncertain, and not because of some natural disaster or foreign attack, but because elected leaders in Washington have turned a routine funding debate into a political weapon. That's exactly what's happening right now in the nation's capital, where a tense standoff over federal spending has left the government at a standstill and millions of Americans caught in the crossfire. At the center of this showdown are two competing narratives. Speaker Mike Johnson and his Republican allies argue that Democrats have rejected what they call a clean resolution to keep the government open, claiming that Democrats flipped the script and are now harming real people. But Democrats, led by House Minority Leader Hakeem Jeffries, say the opposite is true, that this shutdown is a deliberate strategy by Trump-aligned Republicans to gut healthcare programs and reward wealthy donors while everyday Americans suffer the consequences. Republicans insist their funding bill was simple and standard, merely asking for time to finish the budget process. They frame this shutdown as a problem created by Democrats, pointing to past occasions where continuing resolutions passed without drama. But Democrats counter that this time is different. They argue Republicans have tied essential government funding to major cuts in healthcare, Medicaid, and other programs critical to working-class families. According to Jeffries, these cuts are the largest in U.S. history, stripping food aid from children, veterans, and seniors, while funneling tax breaks to billionaires. Much of the current fight centers on healthcare. Democrats want to extend Affordable Care Act subsidies that help millions of Americans afford insurance, with premiums otherwise set to skyrocket by as much as 75% on average if those credits expire. Also want to reverse parts of Trump-era legislation that reduced Medicaid eligibility for certain legal immigrants, such as refugees and asylum seekers. Republicans, however, claim this amounts to free health care for undocumented immigrants, a claim Democrats and independent experts say is simply false. Here's the reality. Undocumented immigrants cannot enroll in marketplace insurance plans under the ACA, nor can they access Medicaid or Medicare. Those rules have been in place for decades, including under Republican presidents. The current Democratic proposal does not change that. What it does aim to do is restore access for people with legal status who lost coverage under Trump's policies. Yet Republicans continue to frame this as an immigration giveaway because it's a powerful talking point, even if it misrepresents the facts. Adding to the tension are broader fears about what some call the Project 2025 agenda, a plan to weaken federal institutions through mass firings and restructuring. Critics warn the shutdown could become a tool to justify firing government workers or reshaping agencies, leaving ordinary Americans without essential services. Democrats argue this is part of a larger pattern of chaos and sabotage from Trump-aligned Republicans, pointing to previous ICE raids, tax cuts for the wealthy, and healthcare rollbacks as evidence. The stakes for ordinary Americans could not be higher. Federal workers are facing missed paychecks. Veterans could lose access to timely care. Rural hospitals and clinics already struggling risk closure. And millions of families may soon receive notices about skyrocketing premiums, co-pays, and deductibles if healthcare subsidies aren't extended. This isn't an abstract fight about numbers on a spreadsheet. It's about whether people can afford medicine, keep their jobs, or put food on the table. Republicans argue that these steps are necessary for fiscal discipline, but critics note their version of discipline consistently targets programs for working families while protecting tax breaks for the wealthiest Americans. During the Biden years, Democrats provided the votes to keep the government open even when they disagreed with policy writers. This time, Trump has pushed Republicans to hold the line, with Speaker Johnson echoing his talking points. The result is a shutdown with real-world consequences and no clear end in sight. The debate over healthcare access for immigrants is an important one, and reasonable people can disagree about the policy, but it's not what's on the table in this particular fight. The current Democratic proposal does not give free healthcare to undocumented immigrants. Full stop. Yet by framing it that way, Republicans avoid acknowledging that their plan would take coverage away from millions of working-class Americans. As this standoff drags on, one thing is clear. The American people are paying the price for political brinkmanship. Instead of governing, leaders are playing chicken with essential services, using families, veterans, and healthcare as bargaining chips. Speaker Johnson says real people are being harmed. And he's right, just not in the way he means. Real people are being harmed because Republicans under Trump's influence have chosen chaos over compromise, loyalty tests over responsible governance. If they succeed, the damage won't end with this shutdown. It will ripple outward, raising costs for families, shuttering hospitals, and eroding public trust in government itself. The question now isn't just when the government will reopen. It's whether Americans will continue to tolerate a political strategy that treats their livelihoods as leverage.